These are the headlines for the SOAPIE Subjective Objective Information Assessment Plan Intervention and Evaluation. For FDAR Focus Data Action Response. For EHR Electronic Health Record. For the POMR Problem-Oriented Medical Record. Live from the melting pot of the South and the only Slavic city in the Philippines, Marawi City, this is the CHS News. Assalamualaikum, Mindanao State University and good day, Marawi City.
Fact and Fresh News, CHS News After Service.
This is Sahata C. Bohari.
And I am Snihayah Calandada, when we connect the dots.
For the SOAPIE live from Municipality of Idsaan Rabain, here is Jaweerah Camama for the updates.
Yes, Sahata. Today I will be reporting the subjective data, objective data, planning, assessment, intervention, and evaluation. Assessment is the first step and involves critical thinking skills and data collection. Assessment findings include current vital signs, lab values and changes in condition, and medical history with recommendations provided by the nurse. Subjective data are information from the client's point of view, including feelings, perceptions, and concern obtained through interviews. Objective data, on the other hand, are observable and measurable data obtained through observations, physical examination, laboratory, and diagnostic testing. Planning stage is where goals and outcomes are formulated that directly impact patient care based on ADP guidelines. Intervention are actions a nurse takes to implement their patient care plan, including any treatments, procedures, or teaching moments intended to improve the patient's comfort and health. Evaluation is defined as the judgment of effectiveness of nursing care to meet the client's goal. That will be all for the SOAPIE live here at the Municipality of Idsaan Lanao del Sur. Back to you, Sahata.
For the FDAR, here's Janisah A.
Focus, data, action, and response. An FDAR chart is a common tool nurses may use to track patients' health information. In these charts, nurses can monitor patient data and evaluate their treatment progress in an organized way. If you're a nurse or entering the healthcare profession, learning more about the components of FDAR charts could help you record information accurately to ensure patients receive the care they need. In this video, we explain what an FDAR chart is, discuss when and why nurses use this chart, and provide a template and examples for creating your own. What is an FDAR chart? An FDAR, or focus chart, is a table that nurses and other medical professionals commonly use to track patients' progress. This chart helps nurses, doctors, and other specialists to communicate with each other throughout different shifts by organizing a patient's information in a standard format. In addition, focus charting assists nurses in documenting patient reports by providing a systematic template for each patient and their specific concerns and strengths to the focus of care. FDAR stands for Focus, Data, Action, and Response. Each category represents the following information. Focus is the issue that the nurse addresses when visiting the patient. This can be a diagnosis, pain monitoring, or health lesson. Data is the information about the patient's current status. This can include the patient's vital signs or a noticeable change in the patient's condition or behavior. Action. This is the action the nurse takes in response to the data. For example, the nurse might replace a bandage if they noticed it needed to be changed. This is the response that the patient shows after receiving any treatment. For example, this might include a change in the patient's vital signs after receiving medication. Why is FDAR charting important? FDAR charting is important because it shows patients' current health status and progress updates in an organized document. This helps medical professionals, including nurses and doctors, stay informed about the patient's vital signs, treatments, and progress. Medical professionals can use this information to adjust the patient's treatment options and monitor their health trends. FDAR charting also keeps information neat and accurate. When nurses rotate or change shifts, they can quickly view a patient chart to see what happened and how the patient responded to treatment during the previous shift. They can record any new information on the chart to keep their medical team updated on the patient's health. When do nurses use an FDAR chart? Nurses may use an FDAR chart to record information throughout the day. They may record information when one of the following events occurs: diagnosis, pain, patient event, treatment response, health lesson, organizational event. A diagnosis is when medical professionals determine the underlying cause of a patient's symptoms. Nurses may track their patient's pain levels throughout the day to assess their current health. A patient event is usually an unexpected symptom or action that happens, such as vomiting, fever, or a sudden change in blood pressure. Treatment response. A treatment response is how a patient's condition improves or declines in response to a specific treatment. Health lesson. A health lesson is when a nurse or medical professional teaches their patient something related to their individual treatment. An organizational event usually means a change in the patient's healthcare procedure. For example, if the doctor changes the patient's status or treatment plan, the medical team might record this event in the FDAR chart. This is an example of FDAR sample charting.
Janisah A Cairoden reporting. For the electronic health record, live from Municipality of Tugaya, here is Aya Calauto.
So thank you, Snihayah. So this episode will highlight some important work or health information pioneers and show how programs such as electronic records can help make healthcare both safer and more efficient.
So let us define what is electronic health record. An electronic version of a patient's medical history that is maintained by the provider over time. It may include all of the key administrative clinical data relevant to that person's care under a particular provider, including demographics, progress notes, problems, medications, and vital signs. Whether it's ensuring prescriptions are written and dispensed correctly, monitoring patients from a distance, or diagnosing patients in rural areas of the country, there are many ways to affect the patient's safety. EHR, a resilient health system with us its patient at East Center D, Tugaya Health Center. There are health records are written on pages in folders and files which could be in many locations around the country. Many of us as patients have already experienced the limitations of this system: waiting lists, difficult communication between departments, filling out form from form, missing appointments, limited access to our own information internationally. Health systems have transformed by switching to digital records, and now the THC, which is delivering a Health Ireland, is taking the first step to develop National Electronic Health Record, or a resilient health system. With us, its patients at its center with a digital system, we can say goodbye to many of the restrictions of the old system and welcome a new modern system that will enable us, the patients and clients of the health services, to have full access to our own personal health information. Facilitate collaboration working practices where different health professionals can work together in real time in order to provide each of us with the best care, enable fast access to services which will provide waiting lists and our care and handle our information using the most advanced data security measures. After all, our health information is personal and private, introducing EHR to the existing health system, so it is such good news for all the rural areas like Tugaya, Lanao del Sur.
Patients and providers alike and strive to make patient safety a priority. So live here at Municipality of Tugaya, back to you, Snihayah.
For the problem-oriented medical record, here is Aslema Buat.
The problem-oriented medical record is a comprehensive approach to recording and accessing patient medical data. It was first developed by Lawrence Reed in the 1960s. The POMR gathered information from all members of the patient care team in order to determine a diagnosis and create a treatment plan. The POMR typically includes the patient history, symptoms, test result, treatment plan, progress notes, and a discharge summary, including any follow-up steps that must be taken. However, the proper use of the POMR does just the opposite and result in a concise, complete, and accurate recording keeping. Matt Douglas, also a co-founder and senior vice president of customer experience EHR vendor practice fusion, offers an example of how POMR works. Quoted, "You can think of a POMR as a different view, different type, or by which physician order the patient problem. POMR are especially beneficial for documenting chronic illnesses, which may require multiple treatment methods that must be adjusted over time. The tool also helps cases in which patients with complex medical issues see more than one physician. Such documentation is particularly important when the treatment of multiple illnesses interact. In addition, POMR help patients become better educated about their own health issues and how they're being handled. Some settings are more conducive to POMR use than others. For example, the POMR is less likely to be used in outpatient setting in which patients are seen for only few minutes and turn around in fairly rapid. In hospital and home care setting, however, physicians are more focused on organizing patient issue into primary and secondary hierarchies. Therefore, the POMR is becoming more prevalent in both hospital and home environment, where clinicians can take more time in evaluating and working with patients. In today's MR environment, the POMR can classify such subjective, objective assessment and plan, or SOP note, a form of documentation that allow clinicians to include notes in the patient record. The POMR, the SOAP note, not only encompasses the patient history, thus result in other pertinent health information, but also the physician observation, a list of issues prioritized in order of importance, and notes on why the problems are organized in a particular way. Furthermore, it is divided into 3 distinct components for diagnostic, therapeutic, and patient education plan.
Aslema Buat, Municipality of Balindo, CHS News.
That is our 12 minutes news service.
Home of Facts, foundation of fresh news. This is the CHS News.
I am Sahata C. Bohari.
And I am Snihayah Calandada when we connect the dots.